Welcome, everyone. It's great to have you all here. Good evening, good morning, good afternoon, and thank you so much for joining us in the first of our 45th anniversary webinar series. My name is Jess Ogden, and I'm ICRW's Global Director for Research, Impact, and Learning, and I also lead our external relations team here at ICRW. I'm based in our DC office, and I'm broadcasting to you today from my home in rural Northern Virginia on the East Coast of the United States. It's a great honor to be with you today. So the theme of our 45th anniversary year is discovering the proof and disrupting the power, which reflects the fact that since 1976, ICRW's researchers, advocates, and subject matter experts have been shifting the way the international development sector understands gender and the enormous potential of dismantling systemic barriers to advance the progress of women, girls, and other people who are marginalized by virtue of their gender or other identities. ICRW's proof fuels the long-term systemic change that drives gender justice all over the world. So today's webinar will focus on ICRW's work to break barriers and shift norms around gender with young people in India and sub-Saharan Africa. And it's with great pleasure that I turn over the reins now to my dear friend and colleague, Pranita Achyut, who will provide an overview of today's webinar and introduce our panelists. Pranita, over to you.
Thank you, Jess. Good evening, good morning, good afternoon, friends. I'm Pranita. I work as Director Research and Program based at Asia office. I'll be moderating this event, and I promise next 2 hours are going to be interesting and very insightful. But before getting to the topic, let me quickly give you a rundown of the agenda. We have 3 speakers from different regions where ICRW works to bring unique perspective and approaches used to disrupt barrier and shift gender norms. Then we have a panel with 5 speakers to share their experiences, their journey of engaging with adolescents and their ecosystem, and their own journey of transformation and challenges. This will be followed by a question-answer session. To make this event engaging, I request you all to share your reflections in the chat box as the event progresses. There is also a question-answer box. Add your questions there, and we'll try to take as much questions during the session and also follow up subsequently. Coming back to the topic of today's event topic, adolescent girls breaking barriers, setting norms. With over 1.2 billion population, currently we are seeing largest cohort of adolescent in the human history. Around 60% of the global population and 90% living in low and middle income countries. Adolescence is a period of rapid physical, sexual, and brain development, a period when gender beliefs and attitudes intensifies with potentially lifelong effects. But it is also a crucial phase to lay the foundation for healthy transition into empowered citizens. What we have seen through our research work, that discriminatory and rigid gender norms, which typically becomes firmer and more influential during adolescence, prevents many adolescents, particularly girls, from achieving their full potential. Around 15 million girls who get married before age of 18 years face diminished opportunities for education, paid employment, reduced agency and decision-making capacity, and increased risk of intimate partner violence. Even if they are able to cross the threshold of 18 years, many do not get spaces to make and voice their choices and decisions. Sexual and reproductive autonomy seems distant for many girls. Girls are made to feel uncomfortable, ashamed of their body, sexual desires, limited access to information and services around puberty, menstruation, sexuality, abortion, contraception. All these heightens risk for adolescent, both boys and girls, but for girls, the implication and consequences are much larger. Actual and threat of violence are frequently used to limit girls' access to education, public spaces, opportunities to learn and grow, which exclude them further from employment and decision making. Evidences on mental health has shown depression-related illnesses peak in adolescence during adolescence period, which has a direct association with child, early and forced marriage, experience of violence, just as gender norms are being consolidated. Adolescent girls are particularly at risk with a much higher incidence of depression than boys, a trend that persists throughout their reproductive life. We also understand from the existing evidences that gender identity intersect with other excesses of identities like caste, class, religion, ethnicity, and all these amplify inequalities and vulnerabilities. And these must be considered in research and programming with adolescents. ICRW has been working with adolescents and youth for 4 decades, building evidence through research and programming and making evidence-based policy advocacy. Our understanding of adolescent lives, their needs and contributions, barriers, role of gender norms, and how various institutions play a role in maintaining and sustaining those barriers, what works to break those barriers, and what works to shift gender norms. I mean, these have evolved, our understanding have evolved over time, and so have our approaches to engage with them and their ecosystem. Positive youth development approach is one such example, shifting away from problem-focused responses to adolescent and youth. The positive youth development framework argues to focus on 4 domains: asset, agency, contribution, and enabling environment in program policies and practices to achieve the vision of healthy, productive, and engaged youth. Now, what this means, if we really unpack this practically means that adolescent and young people have the necessary resources, skills, and capacities. They perceive and have the ability to employ their assets and aspirations to make or influence their own decisions about their lives. They're engaged as a resource, as source of change for their own and for their communities, positive development, and supported by their environment. And this, I really want everyone to really give that attention, that there has to be a supportive, enabling environment for adolescent to progress. Adolescent and young people's perceptions, experiences, and practices are shaped by their families, peers, and friends, community they live in, and influenced by larger normative and structural issues. It is important to keep adolescents at center, invest in strengthening and upholding their agency, skills, and capabilities, but these are not sufficient to break structural barriers. If not more, it's equally critical to engage with different stakeholders in their ecosystem to challenge gender norms, to address structural barriers, to transform gender relations, to move towards equality. While adolescent and young people can lead the change processes, they cannot be solely responsible for the larger normative and structural change. It has to be a collective process. It is challenging. I recognize, and probably all of us recognize, requires sustained commitment and investment from all spheres. And we'll hear more on what it means to use gender transformative approaches of working with adolescents in socio-ecological framework from all other colleagues, what has been their learnings and insights from different regions. But in this whole discussion, we cannot leave COVID aside. Health, social and economic impact of the pandemic and associated policy decisions on women and girls are massive. We don't really know if we'll ever be able to accurately measure or assess these implications. But we definitely seen that it has really opened the pre-existing, it has really opened wide the cracks of pre-existing inequity, further marginalize vulnerable populations. Early evidence suggests that much of the progress made in a couple of decades on girls' education, child early and post marriage, gender-based violence are probably lost. Our discussion on breaking barriers, changing norm is probably more crucial now than ever to ensure adolescent girls and young women are at the center of rebuilding process to build equitable, sustained, and just society. Without taking any further time, I invite my colleague, Prerna Kumar, Senior Technical Specialist from ICRW Asia, to share insights and learning from research and programming undertaken in Asia region, with a focus on enabling adolescent girls' effective transition from school to work. And before I hand over, we have also kept 10 minutes after all the three presentations. So in case there are any specific questions related to presentation, please add your questions in Q&A chat box, and we'll take as much as possible. Over to you, Prerna.
Thank you, Pranita, and thank you for setting the stage for the conversation that we're having today. And I'm really glad to have this opportunity to represent some of the work that we have been doing at ICRW Asia. Can we move on to the next slide, please? Today, I'll be focusing on one particular program, but before I get into that and the details and share the details of the program and the impact that the program has had on adolescent girls, I think it's just necessary for me to also set the context of ICRW Asia's work in as far as the adolescent girls are concerned. Can we move on to the next slide? Thank you. At ICRW Asia, we have a history of almost 2 decades of adolescent programming. The 3 programs that you see listed here are some of the current programs that are running. But each of these programs has a long history, and a lot of the work in terms of programmatic interventions, designing those based on evidence and generating further evidence has really contributed to the current design of the programs. You would see that I've also, on the screen, you would see an ecosystem model being depicted. The reason why it's there is that in the current shape, all these 3 programs use the ecosystem approach, where we recognize that while the individual needs to be equipped with certain skills and information and also perspective, it's equally important for everyone else around that individual to shift. And therefore, the concept that Pranita was talking about, creating an enabling environment becomes absolutely critical. For Planet Girls, for instance, the 3 programs that are listed here are Planet Girls, which is a program that focuses on building girls' empowerment and employability. Umang, which is a program to end early forced and child marriage. GEMS, which is Gender Equity Movement in Schools, is essentially a program that focuses on building gender equality and promoting gender equality and reducing violence. All the 3 programs have gone through several stages of research and programmatic interventions based on evidence, and each of the 3 programs, as it stands today, uses the ecosystem approach. Today, I'll be delving deeper into Planet Girls, which focuses on building girls' empowerment and employability and supporting them in school-to-work transition. Can we move on to the next? As we said, we use the ecosystem approach, recognizing pretty much the fact that adolescent girls cannot have the onus of change entirely on them. This is a learning that we had from one of our milestone studies in 2013, where we figured that there are 3 critical things that need to change in programming as far as adolescent girls are concerned. This study mapped about 40 interventions across India and looked at various designs and how we really work as far as adolescent programming is concerned. We realized that there were 3 key aspects missing. One is that we either focused on one particular area of work, that is either health or education or livelihood. but we did not really address the needs of adolescent girls in entirety. The second big piece that we realized was that while a lot of the programs use life skills as the basis of really engaging with adolescent girls, they do not necessarily bring in the gender lens very strongly. And because the gender perspective is missing, we kind of believe that life skills are gender neutral when they are actually gender blind. And therefore, we miss out on really equipping girls with the understanding that they require to negotiate with their environment. And the third big piece that we realized was that most programs at that point believed that once you equip the girl with the necessary skill set or necessary information, she'll be able to bring in change. And like I said, the onus cannot alone be on the adolescent girl herself. Therefore, as part of this program, which also emerged and the evolution of this program has almost 5 years behind it, has several circles to it, if you would see, several consecutive circles that you get to see. While the adolescent girl still remains at the center, and we spend and we invest heavily in adolescent girls in building their skill set, their knowledge, their perspective, we also recognize that adolescent boys, parents, teachers, and the community and local institutions are equally important to engage with systematically to be able to provide that enabling environment to the girl that supports and promotes her own fulfillment of her potential, as well as does not really create barriers to that potential. Just to give you a sense of what are the different activities that we engaged with, we used a curriculum which was essentially a gender integrated life skills and employability skills curriculum for the adolescent girls. Simultaneously, the GEMS curriculum, which focuses on reducing violence and promoting gender equity, was transacted with adolescent boys at school. With parents in Delhi, because this was a program which was in two locations, Delhi, which is an urban location, and Jharkhand, which is a rural location, we had slightly different strategy. In Delhi, we engaged with mothers directly and had meetings with mothers to really help them understand the aspiration of their own daughters. And the last session that we had was where the daughter and the mother would sit together and talk about their aspirations for the adolescent girl. And therefore, initiating that conversation. In Jharkhand, because it was not possible to reach out to parents particularly, we worked with the community and we used the strategy of really community-led campaigns the adolescent-led campaigns with community members. We also recognize that school as a space does not necessarily and is not necessarily gender equitable. And therefore, it became absolutely critical for us to also work with teachers to ensure that they do not reiterate and reinforce the gender norms that often girls have to constantly negotiate with. These were various ways. Also, girls were exposed to career fairs where we exposed them to various opportunities that are locally available and non-traditional livelihood opportunities that are locally available for them, as well as training opportunities for them. All of these activities were undertaken by what we call facilitators, who were young people of the age group 18 to 28 from the same communities where we were really undertaking the program, where the interventions were located. And the reason for that was that we realized that these young people were critical to build that rapport, and also they understood the local realities much better. So we invested heavily in these youth facilitators who undertook this program and undertook the intervention. Can we move on to the next slide? It's important to recognize that all of these activities were done with two key objectives in mind. One is to equip the girl with the agency and the skill set that is required for school to work transition, and also to shift norms. Now, how do you really shift norms? And these are three key things that we realize are very, very critical for us. The curriculum that we transacted with adolescent girls, like I said, had a very strong gender lens integrated into the curriculum itself, and therefore we say that it's a gender integrated life skills and employability skills curriculum. The reason why we emphasize on it is that understanding who I am and understanding who I am vis-a-vis the structures that I live in and how it impacts my day-to-day life is absolutely critical for any sort of negotiation that we expect the girls to make. So understanding power, understanding patriarchy, understanding that it's possible for me to really create an identity for myself, and I don't have to be limited to be someone's wife or someone's daughter. Understanding that my roles and responsibilities and expectations are also gendered, and this is not God-given, but I can negotiate and therefore shift it gradually, is equally important. And of course, employability skills and life skills to break the gender stereotypes. Simultaneously, we've engaged with boys and men where, again, their own understanding of how patriarchy provides them those privileges, and which sound really good and nice, but it also restricts their growth in a lot of ways, is something which became a critical conversation. This was also done, like I said, to reduce the threat of violence and harassment. And it was interesting to see that how some of these conversations helped boys to really reflect on in what ways they constantly tend to violate without really understanding the impact it could have on a girl's life. And also this helped us in developing boys as active agents of change and support. So when I was talking about the adolescent-led campaigns in Jharkhand, with the community campaigns that we conducted, boys took equal participation in that. For shifting the social norms, we realized that engaging with parents is important. Equally important is to engage with teachers and institutions. Often institutions equally reinforce the gender norms and the gender realities of these girls. Therefore, that conversation was very, very critical. We also realize that often because of the gendered reality that we live in, all of, whether they're parents, whether they're teachers, whether these institutions, they have very strong anxieties around safety of girl, around really breaking the norms or shifting the norms gradually. And I think it's important, and this is something that we were able to achieve, it's important to really explore this and help them see beyond those anxieties and help them see the solutions and also value of girls within this larger structure. We were also able to really create these networks at the community level to ensure that each one of them finds support from the other to shift the norm gradually. Can we move on to the next slide? I'm just going to briefly touch upon the impact that the program had, and you can actually look at the document that is available on our website to really read more in depth what is the kind of change that we got to see. But some of the critical impacts that we got to see were on self-esteem of girls, the way they value themselves, self-efficacy, where their own understanding of what they can really achieve was something that really moved. Also, gender attitudes and family support was something where we found that the program had a significant impact in urban areas. In urban areas, among the younger girls, we also found that economic self-efficacy and their preparation to work in future had a positive, significant impact. In Jharkhand, because the realities are slightly different and girls are negotiating constantly to really continue their education, we realized that the older girls and we found that older girls had much better and improved career decision-making efficacy. And also the school climate that the program impacted had a positive impact. Girls also found that they had greater peer support after the program from their own male and female peers. I think what's important here is to recognize that a program like this does not just impact individual level factors or individual level outcomes. It also impacts a lot of environmental factors. For instance, family support, school climate. And we do know from our own data, when we have really delved deeper into the data, that family support and school climate impacts girls' aspiration. Also, enlisting teachers' support and perception about the environment also influences girls' career-making self-efficacy. So essentially, an ecosystem approach, a model like that, where you engage with not just the girl, but also all critical actors, helps them really move and build their aspiration, helps them understand that they can also become part of economy and can contribute without too much of fear of pushback and backlash. And these are some of the critical impacts that we got to see. Can we move on to the next slide? On the next slide, you will see a quote from a mother where after the program, she kind of said that, you know, my eldest daughter could not complete her education because I got her married much earlier. But now I have 3 younger daughters who are studying, and I will make sure that they do not get married till they complete education. So the whole, you know, conversation around not just building individuals' capacity, but also ensuring that the actors who really influence their lives significantly also need to be, the interventions need to invest in them and invest in shifting the social norms, therefore, is what we want to emphasize on today. I'm just going to take 1 more minute on the last slide, where I'm going to talk about what does this really mean for adolescent programming in the future. Knowing that parental support and school climate is critical to girls' aspirations and their belief in their ability to make career-related decisions, essentially tells us that parents and schools can actually become very critical aspects of programming. So, for instance, often programs do not necessarily engage with parents or do not necessarily engage with mothers as allies, but rather as gatekeepers. I think that the difference here is that we're bringing in the lens of allies, where you create and you develop this intergenerational programming where mothers also start to really engage with their own daughters and have these conversations. For instance, in India, it's not very common for girls to share their aspirations with their parents. And that conversation really help if you engage in intergenerational programming. In India specifically, and a lot of other global South countries, women's collectives can really be used as those spaces to bring in the intergenerational programming and strengthen adolescent programs therefore. Schools as a safe space. Now again, school is often seen as a place to educate a child, but we do realize that for most adolescent girls, it necessarily is not a safe space. It's not a place where they can share their aspirations, they can share their fears. And therefore, it becomes absolutely critical to also invest in working with the teachers, working with the principal, working with the school system as a whole to build that environment. I'm going to stop here and will be happy to take any questions. Thank you.
Thanks, Prerna. I'm not going to repeat any of the key points that Prerna has already clearly articulated. Moving to our next speakers, now I invite my colleagues from Africa office, Naomi Vandra and Eric Yogon. Both are senior technical specialists. They'll be sharing evidence from gender transformative adolescent SRHR programs, how the program captured youth voices and incorporated in programming to address their specific need. They will also be sharing challenges and implications for future programming. Over to you, Naomi and Eric. And you have 10 minutes.
Thank you very much. Next slide, please. Good afternoon, good morning to our guests. I am speaking from Kampala, and I'm here to share with you ICRW work in partnership with Save the Children, where we were interested in designing a curriculum that could promote and advance gender equality among youth in agricultural and pastoralist livelihoods. In Uganda, of course, there are gender norms that prohibit women and girls from owning land. But beyond that, There are also issues around decision-making in relationships and gender norms around who can do what and who is allowed to make decisions. Therefore, those decisions, we find that they limit girls' advancement even when they have gained skills, for example, in business planning. Next slide, please. So Save the Children, next slide, please. Save the Children had implemented a financial skills development curriculum among youth aged, go back, please, among youth aged 15 to 18 years. However, on evaluation, it was found that the program had not achieved the desired impact, but also that boys seemed to have benefited more than girls. So the girls had remained behind, even when there was this financial stimulus for starting businesses, even when they had received a training on how to start businesses and on how to access markets. So in partnership with ICRW, Save the Children, jointly embarked on reviewing this curriculum. And the aim was, how can we make sure that girls achieve the benefits that, going to the boys who are accessing the same curriculum? But also, this was not just about business. It was about equipping girls to be able to enjoy their sexual health and reproductive rights, and to prevent gender-based violence in their relationships. Most of these young girls drop out of school early and get married, and therefore they are young mothers, but without economic security. So ICRW led a process to review that original curriculum. It was focusing on the individual youth, to equip them for their own self, for skills, like being able to do some analysis, being able to communicate their needs, and being able to plan. But also it was recognized that without really looking at the ecological model of the enabling environment around this girl, then maybe the norms, the social and gender norms that keep the girls from advancing would continue to inhibit progress. So then the curriculum went about, the team went about enhancing some content, infusing the curriculum with gender transformative content for the families of these girls and boys, for the community around. The community obviously includes markets, it includes other stakeholders in the community that would play a role in supporting the girls' aspirations and goals. But also this curriculum had the My Business model. So the idea then was for ICRW to look at the content from the original curriculum and infuse it with gender transformative curriculum around the gender roles, around planning for families, around couple communications and joint decision-making. And then also speaking to these families and building their capacity to be able to support the girls' decisions if they chose to do certain types of livelihoods. So this curriculum development effort was preceded by ICRW conducting a gender assessment, and this was done in Western Uganda among the agricultural and pastoralist communities. And using those findings from the gender analysis, then the team embarked on now adapting the curriculum. Alongside this curriculum, we also came up with content that would now target the social strategic behavior change communication activities for the entire community. So this curriculum is, it takes 5 months of learning, learning sessions with girls and boys, mixed gender sessions. And beyond that 5 months, then the learners are supported with now beginning to think about their businesses, what can they do that can earn them a livelihood. And of course, the content is about making sure that girls are not really boxed into, certain livelihoods that are typically maybe believed to be for men only. So that curriculum allows 3 months of again, like mentoring, peer mentoring, and then some senior mentorship from market actors, from financial institutions, from leaders, and from prominent community members, on conducting market assessments, on finding linkages with government institutions, which sometimes also have funds, but maybe girls may not be able to access them. But also that 3 months includes youth and peer-to-peer networking. Next slide, please. So ICRW then developed a conceptual and theoretical framework. Again, this is something that was building on the work that had started in the previous phase. And the gender transformative curriculum really focused on making sure that communities recognize, respect, and value women's economic contribution to their households and communities, and that institutions are more inclusive toward young women and have strategies to enhance not only their participation, but also their leadership, and that households have more equitable distribution of labor, particularly around care, communication, and making joint decisions on how to allocate household resources. And of course, for the young women, building that empowerment to have a positive self-concept, to have the self-esteem, to have the belief that they can actually also engage in productive and reproductive spheres with, with a sense of control over their time, labor, and also be able to participate in market decisions. Next slide, please. Next slide, please. Yes. So it is not quite easy to talk about all the adaptations that were made, but we looked at, what could we add to enhance now that curricula that was very strong, and we came up with, content that could appeal and be utilized by low literacy communities. So we looked at the methodologies of delivery. For example, we customized stories and integrated discussions on gender barriers, on individual decision-making, savings, and planning goals and goal setting. But for the family level of intervention, we also added key gender-based factors which affect decision-making, power, and roles in the family. Again, we came up with stories and integrated discussions and activities on gender barriers related to households, and equal roles, responsibilities, and time use, and decision-making, power, and control over resources. Again, for the community, we also looked at, how gender plays a role in implementing a community improvement project, and discuss with girls and boys the importance of equal participation and leadership and voice in the communities. But also the gender barriers around the fair distribution and utilization of resources for girls and boys. And finally, under my business module, we also customized and integrated discussions on gender barriers related to business. For example, stereotypical work in agricultural value chains. You know, how could we encourage girls to look beyond the gender stereotypes and aspire to, to go in more economically valuable value chains, and how to get the boys to also be supportive of those decisions, like, being able to negotiate and be agents of change for these new goals for the girls. Everyone got seed funding, but also understanding that in business, there are usually SGBV risks, and these risks were well integrated in the curriculum across the individual, the family, the community, and the business content. So I'd like to pause here for now and have my colleague Eric talk to you about the work that we are doing on the sexual and reproductive health rights of adolescents and young women in Uganda, in partnership with our partners listed there. Eric, over to you.
Yeah, thank you very much, Naomi. Good morning, good afternoon. Happy to share with you the next few minutes on these heroes for development in project that we're implementing in Uganda. It's basically an integrated sexual and reproductive health and rights program in selected high burdened districts in East and Central Uganda. This project is implemented by AMREF as a lead partner, but other partners includes MIFUMI, who's a local partner, and CodeAid, and ICRW is the evaluation partner. Next slide, please. So basically, the goal of the project is to address the lack of empowerment of young girls, boys, and women regarding SRH and sexual and gender-based violence decision-making, low quality sexual and reproductive health and sexual SGBV service provisions, which are not well integrated because of a number of factors, including the lack of action by gatekeepers in communities, and unequal gender norms within those regions. So if you look at the district that we are talking about, the high burden districts, they are districts with very high teenage pregnancy. They are districts with a very high maternal mortality rates. They have high adolescent rates, but also high sexual and gender-based violence rates compared to other districts in Uganda. And these are districts that are very hard to reach. So the project is basically meant to look, is implemented in these regions, but really to look at how do we engage young people and also the gatekeepers to be able to address the issue of low quality of SRH services, as well as low quality of, and to some extent, unavailability of sexual gender-based violence services. Next slide, please. So when we look at this, the local context, and I'm taking from when Naomi shared, when you look at the problem that we have in this district, young people, and I'm looking at 10 to 24-year-olds, and specifically for women 15 to 49, including people with disability in these particular regions. They have a number of challenges that we've been able to identify, which basically relates to limited access to accurate and applicable knowledge on SRH and SGBV. There are also unfavorable attitudes and lack of decision-making among, lack of decision-making skills amongst young people and adolescents in this particular region. I've talked about the low quality of SRH and SGBV services, including the service delivery points that are not well integrated. With COVID, these have been disrupted. And then there are also societal pressures, which really puts a lot of pressure on young people, on their parents, the relatives of young people, and really people with authority. So we've identified 4 pathways to address the program outcomes, which is basically looking at the young people themselves and the women, so that we're able to assist, to strengthen their capacity to make healthy choices. How do we increase uptake and quality of services, because we've talked about low quality of services, and then engaging the gatekeepers and communities to be able to take action and reject some of the societal norms and practices that perpetuate gender inequality and sexual and gender-based violence. The overall intention is to improve really the quality of SGBV response systems to effectively address these violations that are happening. So these are fairly new projects. We actually at this point conducting a baseline to really find out what is the current situation, and so that we're able to really inform the design of interventions to be rolled out. Next slide, please. So what we have done is we've developed a sociopolitical model to help us analyze the problem that are facing young people. And with this problem analysis, we are looking at a multi-layered, which is basically multi-layered in a societal system, which basically looks at the context, the setting, the relationships, and then the victimization. So specifically looking at, we're able to really look at the gender integration as well as adolescent integration across various setups. So looking at, and personally amongst women and girls, looking at their agency and decision-making skills. Then we move out in terms of the relationship that they are having with fellow young people and other people who are closer to them, including the providers. Then we move to the community level, basically to look at the attitudes that are prevalent in the community and what actions that needs to be taken, including who needs to take those actions. And then the general societal and structural issues, which includes the issues related to laws and policies, justice to accessing all these issues. So this is the conceptual model that we've just developed, and we are working with our partners and the local governments in the districts that we've identified to be able to first of all identify the key issues that are really affecting these young people, and then secondly, how do we define and inform interventions that are being led. So as we speak now, we are in the process of doing the baseline assessment. Then we will proceed in terms of developing the interventions. Next slide, and I think I should be bringing this to a close here. Yeah, so I need to mention that our role is basically to, we're the evaluation partner. So the evaluation component of the program, we are doing the evaluation with a gender lens role, which is basically to look at not just the issue evaluation and the baseline that is usually done, but how do we inform planning, results and refinement, selecting indicators, working very closely with the community so that it's informed at that level. Then we'll do a midline evaluation, and then we'll do a final evaluation to really look at what has changed from this work. But through the process, because we are a learning partner, we are generating data and utilizing as we go along to inform all these program implementation activities. Thank you very much. I'll take it back to Pranita.
Thank you, Eric and Naomi, for sharing some of this exciting work that you all are doing. And we are looking forward to more results from the evaluation of this program. Now moving to our third speaker, Laura. Laura Hansen is a senior social and behavioral scientist at ICRW US. Laura will be talking about the Engage project implementation and evaluation, which was done in Malawi, a project which primarily focused on empowering girls to shift norms related to child marriage. And she's going to talk about program approaches and strategies and how those worked with and for girls. Over to you, Laura.
Thanks, Pranita. Hi, everyone. Really excited to be here today as part of this session on shifting norms. As Pranita just said, I'm going to talk about the Engage project, which stands for Enabling Girls to Advance Gender Equity. It's a project in Southern Malawi that focuses on empowering girls and communities to shift norms, mostly focused around child marriage, but other issues as well. Slide. So Malawi continues to have very high rates of child marriage. More than half the girls under 18 are married before they're 18. Engage specifically worked in Southern Malawi in 2 districts, Palombe and Cholo districts. The Engage project started in 2016 and ended, the programmatic piece ended in 2020. And it really sought to empower girls and civil society organizations, or CSOs, to work with traditional and religious leaders, male authority figures, other duty bearers in the community to shift norms and attitudes around child marriage, increase gender equity in the communities, eventually to reduce the prevalence of child marriage and other harmful and traditional practices, and contributing to other outcomes such as keeping girls in school, supporting sexual and reproductive health of adolescent girls, etc. So the Engage project consisted of 2 intervention components. The first was working specifically with adolescent girls, so training and working with girls to form them to be leaders so they can form girl clubs in their communities and do other leadership activities related to issues around child marriage, rallying for change in their communities. The second intervention activity was working with civil society organizations, these CSOs, to engage with other stakeholders in the community and to hold community leaders accountable. There actually was a third intervention component that worked with SMS and radio, but that was distributed evenly across the communities and was not included in the formal evaluation. So I won't be spending as much time talking about that today. The Engage project was led by an organization called Rise Up. They implemented the CSO component. The Girls Empowerment Network of Malawi, or GENET, implemented the girl intervention, and Yoneco and Youth Tech Health worked on the SMS radio component, and ICRW, us, served as the evaluation partner. Slide. So I want to provide a few more details about the interventions themselves, which were mostly working, as I said, with and alongside girls. So GENET worked with 2 cohort of girls for a total of 773 girls that they trained, ages 15 to 17, and really in trying to get them to take on a greater role in decisions that related to their life, specifically around marriage, education, sexual reproductive health, etc. And the Engage project trained these girl leaders by building their skills, their advocacy skills, their public speaking skills, helping them understand what their rights are in the community, helping them learn how to have difficult conversations with adult figures, etc. And then these girl leaders went and formed girl clubs in their communities. And these girl clubs were with girls ages 10 to 18. And they sort of trained those girls in similar skill sets and help them understand what are the issues we care about, how can we talk about them in the community. Girl leaders also conducted a lot of community level activities, such as door-to-door visits, community level events, working with stakeholders and traditional leaders to have these conversations. They also did father-daughter chats, again, trying to break down some of the barriers that have been present before and who and how they could talk about issues. Then on the other side, Rise Up trained 36 civil society organization leaders, provided them with technical support as well as financial support so that they could go out and implement 8 advocacy strategies in the communities. These advocacy strategies were, again, on the same topics related to child marriage, keeping girls in school, etc. These leaders implemented their advocacy projects to, again, hold community leaders accountable and, again, sort of provide that enabling environment structure in the community to have more broad reach. Sort of the underlying theory of change for this project is that by empowering girls with these skills and agencies, they would be able to take action in their own communities on the issues that they really care about, working with other girls and leaders in their communities to shift these social norms around child marriage. Slide. I wanted to briefly touch on the evaluation because I think we kind of set out to answer an important question, and especially as I've been reflecting on Pranita's opening, kind of setting the stage for us and Prerna's conversation around that enabling environment and how important it is. But as Prerna also kind of alluded to, I don't think we've always thought about that, you know, traditionally when we're coming up with programming, and a lot of it is putting the emphasis and the burden on girls to sort of make the change all themselves. So we really set out to answer this question of, is it sufficient enough just to empower girls, or do you really need to bolster that enabling environment around them to support them in order to see lasting norm change? So that's the question we set out to answer. So we used a multi-arm quasi-experimental mixed methods design in 4 communities. So in the first community, we just had the girls intervention. The second community, we had the CSO intervention. The third community, we had the girls and the CSO community intervention. And then the fourth community served as a comparison community. We conducted a quantitative baseline survey with randomly sampled community members. And then because of COVID, unfortunately, our end line has been delayed. We have not yet been able to get back out to these communities. Hopefully that will be able to happen soon so we can really be able to finish this evaluation and answer this question. But we have been able to conduct 2 rounds of qualitative, really robust qualitative interviews. So we did that halfway through program implementation and then right after implementation ended in 2020. Next slide. So of course we have a lot of findings to share. I'm just going to highlight a few of the things that I think are most relevant to this discussion today. This is all coming from our qualitative work, mostly from Endline. So first, you know, really just saw that girl leaders were able, and especially comparing the interviews from the beginning of the program to the end line, just seeing how girls were better able to articulate the issues they care about, talk about their confidence that they increased, the self-efficacy they felt, saying things like, now I'm able to go out and talk about these issues with adults. I feel comfortable, like I'm able to articulate things that matter to me. So that was really inspirational. You know, talking with girl leaders, CSO leaders, other community members, they really felt that this program made a difference in their communities. They talked about there being fewer child marriages, fewer pregnancies, more girls in school, more acceptance of girls being able to use family planning methods, more support for girls in general, and especially a tremendous improvement in the initiation camps, which I haven't talked about much, but sort of at puberty, these camps that girls go through, which perpetuate a lot of harmful and traditional practices, had really seen a shift in these communities for the better. And then there was a lot of changes to bylaws and other structural aspects in the communities. I think that related a lot to the CSO work because a lot of their work was around shifting and changing, you know, community level laws. So we really did see that change in the enabling environment. And as I said, we haven't been able to formally test this through the evaluation yet, but we suspect based on the qualitative findings that girls kind of, they do need the support. And I think that's what we've been saying in all of these presentations today. You know, girls can do a lot, but they still need other adults in the community who are able to sort of help support them to do that. And I think that did bear out in some of the qualitative work that we found. And one of those had to do with community resistance. I think at the beginning of the project, there was quite a bit of resistance and girls experienced, you know, ridicule and other things that were said to them by community members. And I think having the support of adults, the CSOs able to sort of talk to people was helpful to get more program buy-in. And just lastly, and it's important to note the damaging effects of the COVID pandemic, especially some of the social distancing practices. Schools were closed for 5 months and nearly all participants referenced this in the qualitative end line, saying that how detrimental it was in their communities. Marriages were back up again, girls were getting pregnant, girls were falling behind. So just a reminder that, you know, changing social norms is extremely important, but there's also very real structural issues that play in as well that we have to pay attention to. So next slide. So that's all I wanted to share with you today. I know that was very fast, but I want to make sure we have time for questions and answers, and I'm happy to answer any questions people have. So thank you.
Thanks, Laura. And there's been very interesting questions. So we'll just take a few minutes and just a couple of questions because we'll have later on some more time. So there's one question which is, I think it is relevant for both Prerna and Laura. That question around backlash. So like, the moment we talk about changing those norms, engaging girls who are already quite vulnerable, lower at the social hierarchy. So maybe Prerna, you can begin. What's been like your experience, like Planet Girls program experience, and what actions were taken to address? And then we request Laura also to reflect on this question.
Thank you, Pranita. It is a very real fear that we've always had in the field about backlash from parents, backlash from community members. In fact, we have seen cases where the parents would insist that the girl should not participate in the program. Often what helped were, like I said, youth facilitators were critical to this program because they came from the same communities. And they became the spokesperson and they became the negotiators with the parents. So we know of this case where a young girl, because as part of the community campaigns, which were led by Adolescents, they used to do a lot of these role plays in the community center of the community or some kind of a market space where there are more people. There was a girl who was very, very keen to participate, but her parents just refused and they did not budge at all. She tried negotiating herself, but they said, this is just not possible. We will not allow you. And at that point, we realized that youth facilitators' intervention, individual intervention with the parents, understanding their anxiety, helping them see how it helps the girl grow, also kind of creates that space for not just a conversation with the youth facilitator, but also with the girl. And like I said in one of my responses to the questions, which was around, really shifting norms for the mothers, it's really important to help parents see that they also have aspirations for their children. Their aspirations might be limited by the norms, but they have aspirations. They also want the best for their child. So for them to be able to see where the gap lies in terms of aspirations between what their child wants to do versus what they want to do for their child, also kind of help move that conversation ahead. So one of the strategies that we used was this. The other, like I said, for the larger, at a macro level, we realized that creating support networks became very critical. So for instance, knowing that some of the teachers became our program champions. Also, we invited some of the other organizations who were working in the community, along with the community leaders who were engaging with the program, to create this network for really addressing if there is any issue that an adolescent girl is facing. So these were some of the strategies that we used.
Thanks, Prerna. Laura?
Yeah, so I just quickly mentioned some of the backlash, but what we heard from girls through the interviews is when they would go to these door-to-door visits trying to talk to parents and of young girls who were of marriageable age, they would be chased, they would be yelled names at. I know they experienced lots of community members calling them prostitutes for promoting, family planning use, things like that. And I think there were two things that kind of helped that. The first was the program team, once they learned about some of this, one of the strategies they used actually was to incorporate involving men more. That wasn't initially part of the program, but they felt like that it would be really important to engage men in the process. So that was one tactic that they used. Another thing too, as I mentioned, was sort of the structural piece of this, and a lot of the CSO leaders and girls themselves working to change the bylaws. And I think through changing the bylaws and some of the enforcement of the bylaws and penalties that might get paid, I think some people who were resistant to the program were, having their backlash be punished in some way or reinforced having to pay fines if they did things. So I think that structural piece also put some pressure on community members to, maybe they didn't shift their norms, but they at least were quieting down a bit on it. So those are just a couple of quick thoughts.
Thanks, Laura. And I know, Laura, you won't be there towards the end when we'll have specific session. Do you want to just reflect a little bit more on the changes, especially around norms related to adolescent sexual and reproductive health, and what were those, and how, like, you know, what were the manifestations of those changes? Some reflection on that can be helpful.
Sure, and yes, apologies to everyone. I do have to step off for another event, but yeah, I think we were really, you know, I personally was really surprised and excited about how much shift we had seen in, you know, community attitudes towards girls' use of and acceptance of family planning. On our baseline quantitative survey, we administered a couple of scales related to this, and attitudes by community members were very low, very poor support for adolescents' use. You know, they are prostitutes if they're using, they should not be using contraception. And again, we don't have the end line quite yet to see those quantitative shifts, but just talking to the girls, the CSO leaders, and community members at Endline, they all talked about how much more support there was in the communities from parents, from teachers, from, you know, people who work in hospitals, for girls to be able to go to the hospital, be able to access family planning, seeing that as an empowering thing. Girls talked a lot about that. Like, I used to be afraid, I would be, you know, shamed, but now I'm able to, you know, go to the clinic and get family planning. And I feel like that's an impact. I'm choosing my education by doing this. I'm choosing my future by doing this. And that was really inspirational to see. So yeah, thank you.
No, thank you. I mean, and this really shows the outlook, how the outlook of those duty bearers has shifted, be it parents or service provider. So that's really interesting. We have 3 more minutes. Do you want to reflect on the COVID implication? And if, I mean, the program is still ongoing, is there any specific shift that you all done in the program implementation strategy in view of COVID?
So for the Engage project, actually, almost all of the work for the program had been done by the time COVID came along. I think the only activities that were still ongoing were some of the CSO strategies, you know, continuing to see those through. So luckily for the program, we were able to finish, but it's only the evaluation that's been delayed because of COVID. But just as I mentioned through the interviews we did, and we asked specifically about COVID and implications, and everyone did talk about how they felt that it regressed some of the progress that Engage had made, and people were very upset about that, and they worried about it long term, just especially around the girls being out of school for 5 months, and, you know, either not being able to return for financial reasons or just falling behind and not being able to return, and then sort of, you know, picking up other behaviors. So yeah, that's where things left off. So we're anxious to finish the survey and be able to think about the impact of COVID as well, and the program in the community.
Thanks, Laura. And I think we'll discuss a little more some of these questions towards the after the panel discussion that we have, and probably during this panel discussion we'll hear more about some of the ground realities and what teams have done during the COVID time, and how it's been easy or difficult to really work with structure and systems towards changing gender norms and changing gender relations. So now I invite my colleague Tanvi Jha. She's technical specialist based at Asia office. She will be moderating the panel discussion, and this discussion will mostly happen in Hindi, and for convenience of English speaking audience, Tanvi will translate. In addition, other colleagues Aditi and Hemlata will also be putting summary in chat box for easy reference. Hemlata has been doing for right now Hindi audience. She'll be doing also for the English audience. So over to you, Tanvi.
Thank you, Pranita. We have already heard about the Umang and GEMS programs and how we are working towards adolescent empowerment here back in Jharkhand. And today we will be hearing from our panelists who will be giving some real life examples of the kind of backlash they have faced, how they have been able to overcome the barriers that are prevalent in their communities, since they are living in communities which have a child marriage prevalence, and there is very low value given to girl child education. So I would like to introduce you to our panelists. We have 5 panelists today. we have, next slide, please. We have Miss Monica, who is a government school teacher, and she is also a nodal teacher for the Umang program. And she would be talking about how she has been able to do away with the taboos around menstruation inside her school campus, as well as in her life and around in her community. Then we have Sangeeta Kumari. Next slide, please. Sangeeta is a youth from the Umang intervention area, and she has been associated with the Umang program through the group education activities. And she is herself a national level football player and aspires to become an international player. So she would be telling us her story. And we also have with us Mr. Raj Kishan. Next slide, please. So Raj is also hailing from the same community where Sangeeta lives, and child marriage incidence is very high in the community where Raj is living, and he would be telling about how he has been engaged in Umang's male engagement sessions and how he has been able to bring change into the life of his sister for whom an early marriage had been planned. Next slide. We have Savitri Soren, who is a field facilitator from the Umang program. She also underwent child marriage, and she would be telling a story about how she was able to overcome the barriers that were in front of her when she was married off at an early age, and she also went through an early pregnancy and childbirth. And today she has been able to join the Umang program as a field facilitator. So we would be hearing from Savitri. And we have one more speaker, Munna. Next slide. He is also a field facilitator from the Umang program. And he would be talking about a very interesting issue that is about this thing about not allowing females to wear what they feel like, which is a trivial thing in itself, but it is a very big issue in a community where he lives in. And he would talk about how he was able to break this norm in his community, and his sister is also now associated with the Umang program as a field facilitator. So I would invite our panelists to talk about their stories. So it will be Monica who would go first. Monica?
Yes, ma'am. Good evening, everyone. Good morning. मेरा नाम मोनिका कुमारी है। मैं आप लोग से ये बताना चाहती हूँ कि जो भी हम लोग अपने आसपास देखते हैं जो नेचुरल है, गर्ल्स के बारे में बात कर रही हूँ कि मेंस्ट्रुएशन और पीरियड बहुत ही नेचुरल प्रोसेस है, लेकिन हम लोग अपने कम्युनिटी में देखते हैं कि ये बहुत ज्यादा सप्रेस्ड है, इसके बारे में कोई बात करना नहीं चाहता है। मैंने अपने अर्ली एज में देखा था कि इस बात को हमेशा चुप करके रहना पड़ता था, किसी से डिस्कशन हम लोग नहीं किया करते थे कि अगर डिस्कशन करेंगे तो कुछ उसमें हमें ऐसा हेजिटेशन होता था, ऐसा सिखाया जाता था सोसाइटी में कि नहीं, इसके बारे में बातचीत नहीं करना है। लेकिन मैं जब स्कूल में आई एज अ टीचर, मैंने देखा कि बच्चे, यहाँ की जो लड़कियां हैं वो लोग ऐसा ही बिहेव कर रही हैं। कुछ बताती हैं कि मैम मुझे छुट्टी लेना है, बट ये वर्ड प्रोनाउंस नहीं करती हैं कि उन्हें पीरियड हो गया है या मेंस्ट्रुएशन साइकिल उनका स्टार्ट हो गया है। वो लोग यूज करती है मैम एमसी हो गया। तो मुझे खुशी हुआ कि शायद उन्हें पता है कि एमसी का मतलब क्या होता है, बट मैंने जब पूछा तो वो लोग नजरें नीचे करके बात कर रही हैं, कुछ भी सामने से कॉन्फिडेंट होकर के इस चीज को नहीं बता रही थी। तो मैंने सोचा बच्चों को बताया कि अगर आप इसे फ्री होकर के नहीं बताओगे तो आप अपने प्रॉब्लम को भी किसी से शेयर नहीं कर पाओगे। तो धीरे धीरे मैंने उन्हें बताना शुरू किया, लेकिन उस समय भी मुझे परेशानी हुई। बच्चे मुझे ऐसे देखते थे कि मैडम ये कैसे बातें कर रही हैं, हमारे घर में तो सब चुप होने को करते हैं और ये मैम यहाँ पे सीधे सीधे बोल रही है। हमारा इंप्रेशन भी थोड़ा वहां पे खराब हुआ, लेकिन थोड़ा जब समय बीता, बच्चों को समझाए, कुछ बच्ची समझी, आपस में डिस्कशन की, तो उन लोग का एक बिल्डअप हुआ कॉन्फिडेंट कि हाँ ये बोलना चाहिए। और जो बच्चे अपनी परेशानी बताती थी, हम लोग उन्हें खुद पैड खरीद के दे देते थे। अगर स्कूल में अवेलेबल नहीं है, उनके पास नहीं है, तो उन लोग को लगा कि नहीं हमें हेल्प मिल रहा है। बाकी लेडीज टीचर भी हमें हेल्प कर रही थी। और भी उन्होंने उन लोग को हमने बताया कि जैसे हमारे यहाँ क्या है, कहा जाता है कि अचार नहीं छूना चाहिए, पेड़ पौधे नहीं छूना चाहिए। इसके बारे में उन लोग को अवेयर कर रही थी कि नहीं, ये सब कुछ चीजें नहीं, ये बायोलॉजिकल प्रोसेस है, कंप्लीटली नेसेसरी, ये होना चाहिए सबको। और आपको इस समय बिल्कुल अपने हाइजीन का ख्याल रखना चाहिए, क्योंकि इंडिया में मेंस्ट्रुएशन साइकिल के समय अगर आप ख्याल नहीं रखते, ऐसे बहुत सारी मौतें हैं जिससे बच्चे नहीं जानते कि हमें ऐसे अपना ख्याल रखना चाहिए। बच्चे बहुत सीखे, वो लोग सामने आए कि हाँ मैम हमें ऐसे परेशानी है। अभी बहुत हद तक बच्चियां बोलती हैं अब और आगे। और मेरा इनिशिएटिव मेरे लाइफ में क्या था कि पहले मैं न्यूज़पेपर में रैप करके पैड खरीदती थी, सैनिटरी नैपकिन। लेकिन जब मैं खुद सोची कि मैं खुद में बदलाव लाऊंगी तब मुझे आसानी होगा, तो मैं शॉपकीपर से बोलती थी मुझे रैप करके मत दीजिए। बट वो बहुत वियर्ड लुक देते थे कि ऐसे कैसे, ये लड़की कैसे कर रही है। पर मैंने बोला नहीं, मुझे करना है। घर में भी मम्मी ने बहुत रोका टकी कि इस तरह नहीं करना चाहिए, सब देखेंगे। फिर मैंने समझाया कि नहीं, ये बिल्कुल नेचुरल है, हम ये बात करेंगे तभी ये बात उठेगी, तभी इस पे सभी कोई डिस्कशन करेंगे और जो लड़कियों को परेशानी होती है वो बोल पाएंगे। मेरा यही इनिशिएटिव था। अब मैं चाहती हूँ कि बॉयज को भी समझाऊं ताकि कोई पीयर में इसको डिस्कशन करें और गर्ल्स बॉयज दोनों मिलकर इस चीज को जाने। थैंक यू सो मच। मेरा इनिशिएटिव यही है और मैं आगे कोशिश करूंगी।
Thank you, Monica. I would quickly give a summary of what Monica just said. She wanted to say that menstruation is a natural phenomenon and it has been very suppressed in our society, and we are never able to talk openly about it. And the girls in her school, they always used to come up to her and they used to whisper to her that kindly excuse me from the classes because I have MC. So she told them that please mention the word clearly and don't be shy. She tried to make them comfortable and also got all the other teachers in the school to bring in this awareness. And she tried to create awareness on menstrual hygiene, and also said that it is the myths around menstruation need to be broken. All the girls, she explained to them that they can touch pickles at any time, they can perform prayers at any time. So menstruation cannot be a deterrent to any of their activities. And in her own life also, whenever she goes to buy a menstrual pad packet, she never hides it behind coverings. And she now wants that she would also make the boys in her school aware of how important these days are, and how these things, if girls are careless, if hygiene is not maintained, it can lead to health issues. So she has been trying to break the stereotypes around menstrual hygiene. Thank you, Monica ji. So I would invite our next speaker, Sangeeta.
नमस्ते मैम, मेरा नाम संगीता कुमारी और मैं पंडुबथान की हूँ। मैं गोड्डा जिला से हूँ। मैं एक राष्ट्रीय खिलाड़ी हूँ और मेरा सपना है कि मैं अंतर्राष्ट्रीय खिलाड़ी बनूं, लेकिन मेरे घर की स्थिति उतनी अच्छी नहीं है, जो कि इसीलिए मेरे मम्मी पापा मेरे शादी करवाना चाहते थे। लेकिन मैं अपने माता पिता और अपने घर वालों को समझाई कि मम्मी मुझे पढ़ना है, आगे बढ़ना है और अपने सपने के बारे में बताया, तो मेरे माता पिता और घर वाले समझ गए और मुझे आगे बढ़ने के लिए अनुमति दी। और मैं अपने सपने को पूरा करने के लिए पूरे मेहनत करने लगी। मेरे पास जर्सी नहीं है, जूता नहीं है, बॉल नहीं, फिर भी मैं अपनी हिम्मत को नहीं हारी और प्रैक्टिस करने के लिए डेली प्रैक्टिस करने लगी। और साथ में अपने पढ़ाई भी कर रही हूँ, अपने भाई बहन को भी पढ़ा रही हूँ। कोविड के वजह से मेरे पापा को काम नहीं मिलता है, इसलिए मैं खुद कमाती हूँ और घर का खर्चा भी उठाती हूँ। और मम्मी 4 साल से बीमार है, उसके लिए दवाई भी खरीदते हैं। और उमंग शास्त्र में मुझे बहुत कुछ सीखने को मिलता है और आगे बढ़ने की मुझे प्रेरणा मिलती है। धन्यवाद।
Thank you, Sangeeta. So Sangeeta wanted to say that she is a national level player and a football player, and she aspires to become an international level player, but she has limited resources and she has been trying to earn for her family. She has been trying to continue her football practice, and very interestingly, the girls in her community, along with the boys are also supporting her, and they are giving her, they are lending their shoes and jerseys to her so that she can practice. And she also does some daily wage work so that she can earn for the family. She is pursuing higher education. Her parents wanted to get her marriage planned very early because they are very poor, but she managed to convince them, and she has been attending the group education activity sessions of Umang, and thereon she realized that she needs to work towards her aspirations, and that is why she is also trying to tutor her younger siblings, and because they cannot afford tuitions. And this is how she has been trying to break all the barriers that come in the way of her education, as well as the sports career that she wants to pursue. So thank you, Sangeeta. So let's get on to our next speaker, that's Raj. Raj?
नमस्ते मैम।
हाँ राज।
आप सभी को जोहार। मैं राज किशन, मैं संथाल समाज से हूँ। हमारे समाज में लड़कियों को शिक्षा का महत्व नहीं दिया जाता है और कम उम्र में ही शादी कराया जाता है। मैं उमंग के चल रहे उमंग परियोजना में मेल एंगेजमेंट में 1-2 सत्र के जुड़ने के बाद मुझे महसूस हुआ कि लड़कियों का शिक्षा में भी महत्व देना चाहिए, और मेरी 2 बहन की जल्दी ही कम उम्र में ही शादी कराई दी गई, और मैं तीसरी बहन को मैं देखा तो मुझे लगा कि उसकी नहीं शादी करनी चाहिए, और मैं अपने माता पिता को समझाया और बोला कि उसकी उतने जल्दी शादी नहीं करानी चाहिए और उसकी आगे के पढ़ाई के लिए सुविधा देनी चाहिए। यहाँ पर बहुत सारे रिश्तेदार आके बोलते थे कि क्यों पढ़ा रहे हो, ऐसा नहीं पढ़ाना चाहिए, लड़की है उसकी तो शादी हो जाएगी। तो फिर भी हमने समझाया उन लोगों को कि समय के साथ अभी आधुनिक युग चल रही है, समय के साथ उन लोगों को भी चलना चाहिए और लड़का और लड़की में कोई ऐसा फर्क नहीं होता है। और अभी मैं अपना बहन को पढ़ाई के साथ साथ अन्य कई चीजों में भी सहायता करता हूँ, और वो अपना ग्रेजुएशन के साथ संथाली भाषा की औलचिकी में वो इंटर कर चुके हैं और कंप्यूटर शिक्षा आगे कर रही है। और हम अपने दोस्त को भी यहाँ पर समझाते हैं कि इस तरह के वो बदलाव लाए अपने घर में, अगल बगल में, और मैं उस बदलाव में अपना दोस्तों का भी सहायता करता हूँ। धन्यवाद।
Thank you, Raj. So Raj wanted to say that he hails from a community where very low value is given to girl child education and child marriage is rampant. And he has seen that his 2 elder sisters were married off at a very early age. So once he started attending the Umang male engagement sessions, he realized that he must do something for his 3rd sister whose marriage was being planned at a very early age. And he stood up in support of her, and she has been able to complete her intermediate in the local Santhali language. And now she is pursuing computer education and also pursuing graduation. And he has been helping her out in her computer classes. So while we were discussing about backlash, so Raj Kishan is someone who has been facing this backlash almost every day, because his relatives and friends, they tell him that why are you doing this, and you should help your parents by getting your sister married off. But he has stood up for his sister, and he tells everybody that times are changing and need to move with the times. And he also wants to advise his friends to bring about similar change in their houses. And also I would like to add in the end that Raj greeted us, all of us, with Johar, which is the welcome language for Jharkhand in India. So yeah, that's all from Raj. And I would like to now invite Savitri. हाँ Savitri.
जोहार आप सभी को। मैं सावित्री और मेरी शादी 17 वर्ष की उम्र में ही हो गई थी जब मैं इंटर में पढ़ती थी। एक लड़का था जो हमारे साथ स्कूल आता था जाता था, लेकिन जब हमारे समुदाय के लोगों ने हमें एक साथ आते जाते देखा तो हमारे घर वालों को बहुत ही उल्टा पुल्टा बताया कि हमारा चक्कर चल रहा है, इसकी तो शादी कर देनी चाहिए, ये पढ़ाई कुछ नहीं करती है। और घर वाले ये सुनकर बहुत गुस्सा हुए और हमारी शादी के लिए मतलब रिश्ता ढूंढने लगे और मतलब फिर उसके साथ फिर शादी के लिए उसको भी बोला गया कि तुम इसके साथ सिर्फ घूमते हो या फिर शादी भी करना है। तो फिर इस तरह करके जल्दबाजी में हमारी शादी हो गई और मैं उस समय बोलना चाह रही थी कि मुझे अभी शादी नहीं करनी है और मैं ये सोच के बोल भी नहीं पाई कि शायद घर वाले मुझे मतलब निर्लज ना समझे, क्योंकि जो लड़की अपने मम्मी पापा के सामने अपना बात रखती है तो उसको बहुत ही बुरा नजर से देखा जाता है। और मैं मतलब ना चाहते हुए भी उस समय मुझे हाँ बोलना पड़ा, क्योंकि मेरी शादी तो तय होनी ही थी, किसी के इसके साथ नहीं तो उसके साथ भी मुझे शादी ही करना था। तो मैंने ये सोच के हाँ कर दिया कि किसी अनजान आदमी से शादी करने से बेहतर है कि परिचय आदमी से ही हाँ बोल दूं। इस तरह करके हमारी शादी हो गई और ससुराल में मतलब कुछ दिनों के बाद ही हमें बोला गया कि अपना खर्च तुम्हें खुद से ही उठाना पड़ेगा। इस दरमियान कुछ ही समय में मैं गर्भवती भी हो गई और मतलब हमारी आर्थिक स्थिति में इतना मतलब गिरावट आ गया और मेरे हस्बैंड के पास भी कुछ काम नहीं था और इस वजह से मेरे हस्बैंड चिंता से एकदम शराब की लत पड़ गई और वो काम करने के बजाय वो एकदम नशे में डूबे रहते थे। तो जब मैं पढ़ने के लिए घर में बोलती थी तो सास ससुर सब गुस्सा करते थे, बोलते थे कि शादी के बाद पढ़ना नहीं है, गांव में लड़कियां शादी के बाद पढ़ती नहीं है, वो हमारे समाज के खिलाफ है। तो मैं किसी तरह जीत करके सारे काम को करके कॉलेज गई अपना बेटी को लेके, फिर इस तरह करके पढ़ाई की और मुझे उमंग परियोजना में काम करने का मौका मिला और उसके बाद मुझे ट्रेनिंग मिली। ट्रेनिंग से मेरी सोच में बहुत बदलाव आया और मेरे काम की लगन को देख के मुझे जल्दी प्रमोशन किया गया और इस कार्य से मैं अपनी पढ़ाई और बेटी की पढ़ाई भी अच्छी तरह से कर पा रही हूँ। और मैंने एक स्कूटी भी लिया है जिससे कि मैं अपने काम में जाती हूँ। और जो लोग मुझे पहले अवहेलना करते थे, बोलते थे कि गलत काम कर रही है, पढ़ाई नहीं करना चाहिए, तो अभी वही लोग मुझे बोलते हैं कि देखो इससे सीखो, अब कितना अच्छा से पढ़ रही है, काम कर रही है, घर का काम भी कर रही है और बेटी को भी पढ़ा रही है। तो उमंग परियोजना को मैं बहुत बहुत धन्यवाद देती हूँ और ये जो सेशन चल रहा है गांव में, इससे मेरी तरह और भी महिलाओं और किशोरियों को सीख मिलेगी और उसके जीवन में मददगार होगी। धन्यवाद।
Thank you, Savitri. Savitri told us her story about how she, just because she had a male friend, she was forced to get married to the male friend, and because the community did not accept this friendship between a girl and a boy, and she was too young and she could not, she did not have that agency to decide for herself, and she felt that this was the best decision for her, and she got married to that male friend. And then she had to face early pregnancy and financial problems. Her husband became alcoholic. She kept wanting to continue her education, but her in-laws did not allow her to pursue higher education. But then she realized that her daughter might have to face the same fate. She enrolled herself into college and she managed to complete all her housework, and then she took her daughter with her to her classes and finally completed her education. She got a job as a field facilitator in the Umang program, and today she has been managing her work, her studies, and she has bought a scooty for herself. So she has become like a role model for all the other girls in the community, and people set her as an example, saying that see how she has been able to manage her life, and every girl should be able to stand up for herself like Savitri. So thank you, Savitri. Now we have Munna with us, and he would be telling us his story.
नमस्कार, मैं मुन्ना कुमार। हमारे समाज और परिवार में लड़कियों के प्रति दृष्टिकोण से मैं भी बहुत प्रभावित थी। जब मेरी बहन भी कहती थी कि हम भी जींस पहने, लेकिन पहनने के लिए नहीं दिया जाता था, कहीं अकेले आने जाने के लिए नहीं दिया जाता था। लेकिन जब मैं उमंग से जुड़ा तब मेरे मानसिकता में बदलाव आया और मैं खुद अपनी बहन को जींस गिफ्ट किया पहनने के लिए। उसके बाद कहीं आने जाने के लिए भी प्रेरित कर रहे हैं कि अकेले आ जा सकती है। लेकिन समाज में कई तरह के बात लोगों ने कहने लगा कि बहन जींस पहनती है, बहन अकेले कॉलेज जाती है। लेकिन मैंने फिर उन लोगों को बताया कि अगर हम जींस पहन सकते तो मेरी बहन क्यों नहीं पहन सकती है, अगर हम अकेले कॉलेज जा सकते, कहीं भी जा सकते तो मेरी बहन क्यों नहीं जा सकती है। फिर इस तरह से हम लोगों को कन्विंस किए। उसके बाद अभी भी बहन को भी प्रेरित कर रहे हैं कि आगे इस तरह बढ़े, और साथ ही साथ अन्य लड़कियों को भी प्रेरित कर रहे हैं कि स्वयं का निर्णय खुद ले सके और आगे हमारे तरफ भी बढ़ सके। थैंक यू।
Thank you, Munna. So Munna here is talking about how the Umang program, association with the Umang program helped him change his own attitudes towards gender issues. Initially, he was not at all comfortable with his sister wearing jeans or going out or on her own. So he used to control her mobility a lot. But once he got engaged with the Umang program and used to attend the group education activities and the various orientations and discourses around gender issues, he realized that these are very trivial things, and he is no one to allow his sister to wear what she feels like. And once this attitude change happened, he also encouraged his sister to start working with the Umang program, and today Munna and his sister both are working as field facilitators in the Umang program, and he has been able to stand up and answer queries around why he's allowing his sister to move around freely, why she is wearing Western dresses, and he has been able to set an example in his community through these efforts of his. So thank you, Munna. So Pranita, I think it's over to you. All our panelists have shared their stories.
Thank you, Tanvi. Thank you, all our panelists. Very inspiring experiences, very grounded experience as to how these transformation, the work that we are doing, manifest on ground, what has been the experiences, backlash, challenges, the struggles that team and individuals go through this process, during this process. And again, it really emphasized the need for working around this issue, bringing different stakeholders in this whole change process, and that's probably the way forward. Thank you everyone. We have some very interesting questions, and I would share a few questions and request if there are specific names, I'll request those. Otherwise, I'll ask any one of the presenter or Tanvi or anyone to pick those questions. So first, then maybe I'll request first Eric and Naomi to take on, and then Prerna can also reflect on this. So there's a question as to can you share any best practices and lessons on how to engage with partner with local government in your specific context to scale impact and integrate norm change in policy and fundings? Any specific example? Naomi, you're on mute. Please unmute yourself. Yeah.
Yeah, sorry. Thank you for the question, and indeed it is a relevant question because just last week we had to deal with a situation where we had mapped a hotspot, a sexual and gender-based violence hotspot in a community, and all our partners were, gathering resources to go and start work. However, the district local government thought that a neighboring community, had a higher burden anecdotally. However, we were able to provide the evidence of how we arrived at a decision to select that community. We were able to demonstrate how we use the district health information systems to highlight the burden of the health facilities that are already dealing with the problem of unsafe abortion, of teenage pregnancy, but we're also able to demonstrate the evidence from the Uganda Bureau of Statistics on the community burden regarding sexual gender-based violence by women of reproductive age group, as well as sexual gender-based violence by adolescents. So we were able to demonstrate the criteria, we were able to demonstrate the evidence that we had used to arrive now at a different community. So that meeting, to be able to have a resolution and have the buy-in of the local government, involved multiple stakeholders from the Ministry of Education at the district level, from the social protection, from the CAO, or what we call the management of the district, so and the district planner. So all the stakeholders at the district level were involved and were able to actually quality check, and they found that the decision making was informed by rigorous analysis and rigorous criteria. Also the important thing was that as a consortium, we have been very honest in our work and transparent. So the team that is going to incentivize SGBV service uptake, they took an independent route and they stuck to the criteria we agreed on as a consortium. But also the community asset mapping group also took a different route, but they all used the criteria we had set out. But they all converged on this community. So what did we learn from that? We learned that the district local governments are very keen in solving the problem of sexual and gender-based violence in their communities. We know that they are keenly aware of where the burden is, but they lack the evidence to actually be able to advocate for those communities. So we were able to start to engage at this point of program design and say, okay, we're going to be able to work in this community, but let us now co-create some solutions to see how we can strengthen the systems for evidence generation in the neighboring community, and how these two communities can actually, either pair up or have some linkages so that no one is left behind, and therefore be able to support the evidence generation, which will now also contribute to the advocacy to get services to the neighboring community. So yes, using evidence and having the transparent systems, having clear criteria is very important, because we know these local governments, they are also concerned about the burden in the community. Thank you very much.
Thanks, Naomi. Very insightful. Reena, do you want to add any other point? Otherwise, I have another question for you.
Sure. Thank you, Pranita, and thank you, Naomi, because yes, data works as a great advocacy tool with the government agencies and officials. One of the other things that we realized in the Indian context that worked very well for us was leveraging the existing policy provisions. So for instance, we know that Pakur, where the district in Jharkhand where we were running the intervention and implementing the program, is an aspirational district where the government is investing a lot more resource for really bringing in changes in education outcomes, livelihood outcomes, and health outcomes. And that kind of also gave us a leverage point with the government officials to really support them wholeheartedly. And I think one thing always helps us to also address their needs. So for instance, in the district of Pakur, while we were, because this was a pilot study, a pilot program and a pilot study that we were running, we were restricted to a certain number of schools and specific schools. But the district education officer wanted us to also engage some of the other schools, which were residential schools for the most marginalized, girls from the most marginalized communities. And we created a space for ensuring that we cater to their needs as well while implementing the program as per our plan. And that also helped build a greater buy-in, a greater acceptability of not just the program, but also constantly sharing data, constantly showcasing the change that we were bringing in, created that space for integrating the program gradually into the system. Thank you.
Thanks, Prerna. Very important. Having a continuous engagement. It's not really a one-time activity, but a continuous engagement buy-in is extremely necessary for the partnership and seeing the sustainability and scalability of a program and the relevant policy hooks which can help in scaling and sustaining those initiatives. There is one specific question, maybe Prerna, you can take that. There's it's a request to share some of the examples of employability skills that you have used and what is the impact, and also if there are specific strategies that were used to engage community leaders.
So quickly on employability skills, essentially the curriculum that we had developed had 4 key parts, 4 key modules, and the 2 modules which were focused on employability were resourcefulness and then employability skills particularly. Now, the resourcefulness module kind of started with an understanding of how work itself is gendered. So why certain tasks that are paid for in a public domain are not really valued in the household. So starting from there, we kind of build the narrative and build the understanding of what is required to engage in work. And what does productive work really, in sense of economy, how is productive work really defined, and then building their capacity to to really map their own goals, plan the pathways for achieving those goals, and helping them and facilitating that process with them, with the girls. Also, we realize that often girls deal with a lot of stress, a lot of constant management of time, because there are greater demands that are made within the household on them. And therefore, things like time management, stress management, developing your CV, also how do you really reach out to prospective employers? How do you make an email account? Or how do you really start interacting with the outside world? So a lot of this basic understanding is what we focused on. We also, like I said earlier, we also had a career fair for girls where we made sure that they were exposed to the local opportunities that are available, not just for jobs, but also for trainings, because often girls drop out early and therefore they're not able to really get the kind of skill or get trained in a certain skill set that is possibly required in the job market. And those were some of the efforts that we made as far as employability was concerned. I've also responded to the question that what were the outcomes that we were looking at. We were looking at building the girls' self-efficacy as far as career-related decision-making is concerned, as far as economic self-efficacy is concerned, and also because these were girls who were still in school, when we were looking at the outcome, we said, are they preparing for work, and what are the steps that they're undertaking to prepare for work in future? So this was related to employability. Sorry, Pranita, I forgot the last question that you had around the community.
There was, yeah, community leaders. Any specific strategy used to engage community leaders?
So with community leaders, we had to have a two-pronged strategy. One was engaging with them individually, helping them understand their anxieties, their issues, what is it that their own understanding of what girls should really be doing. And that kind of helped us build a profile and understand where to really peg the conversation with each of the individual community leaders. Alongside that, we also had community meetings and meetings with these leaders at the panchayat level, which is the local government level. And we brought in various actors, like I said. So for instance, one of the meetings where we discussed a lot of these issues around adolescent girls' education and employability, we brought in the local government officials, the district officials, that focus on livelihood opportunities for women and girls. We also brought in the teacher from the school who was a champion for the program. And this was the teacher from the local school. So we brought in these influencers also to really engage them in a conversation as to what are the possible opportunities, because often when individually you speak to them, they say there are no opportunities for girls, and often parents get the girls married because there is no real economic value that the girl can add to the family. And we were trying to also kind of address some of those myths. We also realized that these were communities where child marriage was rampant and early marriage was rampant. Therefore, we brought in what is called the Child Line, which is a helpline that supports girls and children below 18. Because often as community members, you don't want to take that step of intervening in a marriage below 18 in the community, but it is, you can always call up the Child Line and ask them to intervene. So some of these, bringing in these solutions also help them visualize that there are possibilities and there are possible solutions if you want to achieve that. And at the end of that meeting, we really help them carve out 4 or 5 commitments that they made to the adolescent girls in that meeting. And they said, these are the steps that we will undertake. So yeah, this worked as a strategy for us. Others can also try it out.
Thanks, Prerna. Eric, do you want to add anything on this? Because there is also one question around programming during COVID times. And do you want to take this question? How have you been able to adopt the program during COVID times? Though this question is very specific to school, and how schools as a crucial safe space for girls in rural areas. So yeah, you want to take?
Yeah, thank you. So yeah, so during this COVID period, it's basically affected how we do our programs. But the trick has been, how do we do what we need to do given the circumstances that we find ourselves in. During this COVID period, yes, there have been a lot of SGBV cases, there are a lot of GBV cases. So it's about looking at what, yes, the various governments have put in place measures that we've had to look at. So speaking about the HEROES project in Uganda, for example, working with the local ministries of health to be able to identify when is it safe to go out, when is it not safe, and following those directions. But also being creative in a way of engaging the communities and the local leadership. It's not perfect. It's not been perfect the way we are used to, but being able to work with, I see there are a number of opportunities actually that presented themselves with the increase in GBV cases, with governments tracking down all these cases to the local level, being able to take advantage of those structures that governments are putting in place. And the key thing here is about relationships. relationships with communities, relationship with governments, so that we're able to first ensure we are not exposing anybody, but two, looking at how can we be part of the solution in addressing some of the challenges that have come. So it's about taking advantage of the technologies that are available where possible, but where not possible, what is locally and culturally acceptable within the confines of the Ministry of Health. That has been the trick. Thank you.
Thanks, sir. Yeah, thank you. Tanvi, would you like to also take this question up, like from India's context and from Jharkhand? What has been your experience around the issue? Because I think COVID definitely has given the opportunity, and there's been a lot of expansion of technology, digital space, online classes are happening, but then it's also further marginalizing those who are already marginalized, some of them at least who are already marginalized. So probably also widening the gap between haves and have-nots. So within that space, especially that GEMS and Umang is working with extremely marginalized population, what has been the experience and any specific insights that you want to share, Tanvi?
Yeah, Prerna. So while we were undergoing the first wave and then the second wave happened, so we had used this time to do a lot of situation assessment to understand how things are changing in our intervention communities. And we found that a lot of return migration had happened when the first wave was ongoing. And there was very little space to earn because daily wage was not available. So there was a lot of economic crisis within the communities where we were intervening. And a lot of violence cases started to get reported. And child marriages also started to rise because we got requests from the authorities that can you also help us in addressing these issues. We have been getting reports of increased child marriages. So we tried to address this issue by leveraging existing system level platforms which offer convergence at different levels. So we tried to organize convergence meetings so that policy level issues could be addressed there. And we also leveraged the education department's digital learning platform to understand. One is that we tried to understand what is the outreach of this platform, which was very minimal, but we tried to ensure that more and more children get linked to this education department platform, because there were girls in the community, even boys, who had these smartphones and they were attending classes and they were ready to share it with their friends. So we tried to make these small groups where these children used to get together and attend their virtual classes. And meanwhile, we were also requested by the education department to prepare some material, some audio-visual material for them, which would be enabling the children to access gender-based perspective building. I have also shared links to some of those videos in the chat, so you can access them. And recently, now there is a mixed mode of education that is happening. Teachers have started going to the villages, and we are trying to ensure that we also go with them and try to outreach through our group education activities at the community level. So things are starting to look up, and we hope that soon we will be able to intervene in the schools as well. Thank you.
Thank you, Tanvi. We still have many questions, very interesting questions, but given the time and also reducing number of audience participants, I think we can close the event. Before ending, I really want to thank all of you, our great audience who have been through this last almost 2 hours with us. And it's really nice to see your reflection, your questions, and we hope that some of these conversation continues. We have your emails, though all of you have registered, of course you have registered, but there were a few more who had registered. So we'll be sharing all the presentations. We'll also be sharing recording of it, and would like to really connect. And also we'll try to respond to all those questions which we were not able to attempt right now, and share back with all of you. But would love to engage and connect even later on beyond this event. We are going to, this is like the first event in the series, and we'll be sharing more details about upcoming events. And before closing, I would like to thank all my colleagues who were behind the scene, making this as a, able to organize and making this a success. Specifically, I would like to thank Joe, Lindsay, Akriti, Aditi, Hemlata. They have been doing all the translation, Hindi to English, English to Hindi. Nasreen and many other colleagues at Jharkhand who were able to connect us with our 5 distinguished panelists for the discussion. I would really like to thank all of you. Have a nice evening, afternoon, day, depending on wherever you are. But thank you, all of you. Thanks to all of you. And we need to continue this conversation. This is too critical for us to leave. Thank you all.